So why should people of color be concerned about skin cancer? While we know that skin cancers have a far more higher incidence rate in fair skin, minority patients have poor outcomes. For example, minority patients who are diagnosed with melanoma are 2 to 3 times more likely to die from melanoma compared to their white counterparts. Now, why does this happen? The root causes for these striking disparities are probably related to many reasons, including socioeconomic factors, the lack of skin cancer awareness in the general population, particularly among minority patients, and the differences that we see in presentation in melanoma, for example, in white versus non-white skin, that both patients and physicians may not be aware of. There's also issues we know from many studies about lack of access to timely care by dermatologists. And then there are cultural norms that go along with behavior around skin protection and sunscreen awareness. We know that Black patients are less likely to seek care for changing growth on their skin, and this can also contribute to delays in care and treatment. Physicians, interestingly enough, are also less likely to recommend sunscreen to persons with skin of color. And one study found that physicians did not universally offer advice on how to protect one's skin from the sun in their non-white patients. So we have a long way to go, but it's so important for patients to know that skin cancer can happen in all patient populations, all skin types. It's less likely to happen in our patients with skin of color, but when it does occur, it has a higher risk of morbidity, and it's also more likely to result in poor outcomes such as death. So early diagnosis and awareness is essential.